All right, California, I am here. We just finished up the Universal Studios lot tour. I'm going to give you a quick look here. Then I'm going to move over here just so that we don't have a bunch of people in the way. California is super unique when it comes to Medicare, and it's almost like you have 3 separate states. So in this video, I've got it separated into several different sections. Now, the first section is going to be covering supplement plan rules in California because you do have a unique rule here. The next section is going to cover general Advantage plan rules in California. And then the third section is going to be covering Northern California because you're like your own separate state in the terms of Medicare and how it works and interacts there. The next section will be on Southern California, again, completely different than the rest of the state. And then the final section is gonna be for those of you who are under 65 and who qualify for Medicare. So this could be because you are disabled, you have ESRD or kidney failure, or you have ALS. Now, Central California, you work the same as the general rules that we're gonna outline here in this video. So with supplement plans, you have a birthday rule. Now, we've covered birthday rules in a few other states, and yours works similarly to the states that have birthday rules, meaning around your birthday, you're able to switch from one supplement plan to another supplement plan with no medical underwriting, and that switch has to be to a like plan or lower plan. So for example, a plan G has more benefits than a plan N. So if you are on a plan N, you cannot switch up to a G without going through medical underwriting. Now, medical underwriting, you answer medical questions, and if your health is poor, they will either raise your rates or deny you completely. So that's why this is important, is that here in California around your birthday, you can go from an N to another N with no medical underwriting. You can go from an N down to a different plan, or again, if you're on a G, you could go down to N with no medical underwriting, or a G to G. And that's convenient because if there's an insurance company that has higher rates, then you're able to switch to another insurance company with potentially lower rates with no medical underwriting. That is not the case in most states throughout the United States. That is a big perk to living here in California when it comes to your supplement plan. If you do want to make changes, you have a 60-day window following your birthday to do so. This rule went into effect in 2020, but California has a birthday rule since 2009, so you've had something similar to this for quite a while. California, your costs are going to be right around the national averages. So the national average for a supplement plan G is $150 per person per month starting at a 65-year-old, and here in California it's $150 per person per month. The average for plan N is $120 per person per month at 65, and here in California, same thing, $120 per person per month. There are several opportunities for discounts to bring that cost down. For example, you could have a multi-insured discount. What that means is that there are multiple people in your house that are insured with the same insurance company. Another discount is if you're willing to wear a fitness tracker, a Fitbit, or a smartwatch, or an iWatch, then you can sync that with the insurance company's website. And if they can see that you're exercising, they can give you a discount. Finally, there are discounts if you're paying your premium all up front in 1 year rather than month to month. So there are several opportunities for discounts. If you live in California and you want to get a supplement plan and you're interested in finding those, just reach out to me with the email in the description. I do have partners who are licensed and familiar here in California with supplement and Advantage plans. There are some supplement plans that do have a gym membership if that is what you're looking for, but these are more of an exception than a rule. A notable statistic here in California is the supplement plan penetration rate. So nationally, the rate is 21%. Here in California, 8.8%. It is the second lowest in the country. Supplement plan adoption rate is much lower than you would see otherwise. There are several reasons for that we'll get to. One of them is this is a much higher population that are dually eligible for Medicare and Medicaid. And then again, there's some other reasons that I'll cover here in a second. Now, before I dive into the Advantage plans, I have to mention our sponsors throughout this entire 50-state road trip, and that is ET Family Travel. This California experience has been unreal. We've seen the Redwoods up in Northern California. We stayed in San Francisco at an amazing hotel, and now we're here down at Disney and Universal Studios with an incredible experience with my family, all because of ET Family Travel. They have hosted this entire opportunity for us, and it has been unbelievable. So many memories. I've documented it over on our other channel. We're putting out videos as we go through this to just see the faces on my kids and on my wife. And then we brought along my wife's parents with this too. So to see the grandkids, us, and then the grandparents has just been unbelievable. So thank you, ET Family Travel. If you are planning to go on a trip, whether domestically or international, reach out to ET Family Travel and they will handle all of the frustrating stuff for you. They will book everything, they'll get everything set up, and like Medicare agents, it does not cost you anything to use them. It's going to cost you the same thing if you went directly to a hotel or an experience like this as if you did not use them. So why not use them to get everything set up at no cost? Same thing with Medicare. It doesn't cost you to use us. We're paid through the insurance companies. All right, back to how Advantage plans work here. So in California, the average market penetration rate for Advantage plans is 50%, which is the national average. So you look at how low the supplement plan penetration rate is, how the Advantage plan penetration rate is average. That means, again, a lot more people are choosing other options like either original Medicare only, they're dually eligible for Medicare, Medicaid, or they're taking something like TRICARE for Life, VA benefits, or something else. The average maximum out of pocket, so we got to split this into a few sections here, but the average maximum out of pocket in California as a whole is about $4,800. The national average is right around there. It's about $5,000, just under $5,000. So we're looking at the national average here for most of California. Remember, these are averages, so you will find plans that have higher maximum out-of-pockets and you will find plans that have lower maximum out-of-pockets. There's Claire walking around in the background, interrupting the shot, but I think that she's cuter than I am. All right, let's talk about Northern California, and what makes you a little bit unique here is that it's very hard to find a lot of strong Advantage plans. Your maximum out-of-pockets are gonna be a little bit higher, but Advantage plans aren't as strong in Northern California, so a lot more people, at least in Northern California, are going with other options. And here in Northern California, and this is gonna be the case with all of California, is you do have Kaiser that you get to interact with or that you get to deal with, and I'll get to them here in a minute. But now let's move to Southern California. Remember, Central California, you've kind of already dealt with everything that we've talked about here. Now we're moving to Southern California. So many people go on Advantage plans down here. This is not me saying that you should. Here in Southern California, you have some of the strongest Advantage plans in the entire country. When it comes to your max out of pockets, there are several plans with less than $1,000 maximum out of pockets, which is crazy. There are other options, but it's just a very high penetration rate here in Southern California. There are very few PPOs that allow you to electively seek care out of network, but the PPOs, meaning Preferred Provider Organization plans, do have out of network coverage benefits. It's not as strong as you would have if you went in network, but they do have benefits if you do happen to go out of network. All right, I hinted at this earlier, but you do interact with Kaiser here in California. Now with Kaiser, they do not work with independent agents. If you want a Kaiser plan, you go directly to Kaiser. You have to work with a Kaiser employee to get that plan. Now, when it comes to Kaiser, we've interacted with them a lot along the West Coast here, but the feedback that we get as agents from people who use Kaiser is they either love them or they hate them. It's very polarized. There's not a lot in the middle, and that is because they are an integrated healthcare system. What that means on the positive side is that all your records are there, the hospitals, the doctors, the administrators, everybody's working together in the same system. Statistically, we see this in the data. They have fewer prior authorizations that are denied. Again, the administrators and the doctors know what's going to be pushed through on the insurance side of things to get things covered, so they're making fewer mistakes that way. The negative on the integrated system is you're kind of handcuffed to that system. You don't get to go see doctors outside of the Kaiser system. You don't get to go see providers or facilities that are outside of Kaiser. So if you don't like Kaiser, you don't like the treatments, or you want to seek care elsewhere, and you're on their Advantage plan, you're kind of locked in there. Also in California, even if you have a Medicare supplement plan, Kaiser is not going to take you, and they aren't going to see you, which is really unfortunate. They're only taking their plan within Kaiser and their Advantage plan. So that's just something you have to interact with. That is why people, again, either love them or hate them. So if you know that you want Kaiser and you love them, go directly through Kaiser to get their plan. If you don't like Kaiser and you despise them for whatever reason, work with an independent agent to find other market options. If you aren't sure, you're undecided right now in the middle, what I would suggest is that you look at the Kaiser plans and then also take an independent agent and have them compare the market plans, and then you can compare the two, Kaiser to what you would get on the market, and then you can make an educated decision that way. Again, I do have partners that are licensed and familiar with all of the plans, whether in Northern California, Central California, or Southern California, that can help you through all of this at no cost to you. All right, let's wrap this up for those who are under 65. We've got some music going on here. Hopefully you can still hear me. But you're qualifying for Medicare before 65 if you have a disability, end-stage renal disease or kidney failure, and you're on dialysis, or you have ALS or Lou Gehrig's disease. So if that applies to you, in most states, there isn't a lot of protection for those who are under 65. When it comes to a supplement plan, in most states, you either cannot get a supplement plan, or if you can get a supplement plan, you're limited to a letter like just Plan A, and they're incredibly expensive, like $500, $600, we've seen $1,200 a month to get a supplement plan pre-65. So for pre-65, there's not a lot of protection out there, and it gets really, really tough. You're kind of left with an Advantage plan, or original Medicare only, or maybe you have Medicare as a supplementary benefit with an employer plan, or if you want to pay a lot of money, you can get those supplement plans. But in California, you do have some protection, which is nice. And I would say it's kind of middle of the road here. It isn't extravagant and amazing, but they do have some protection for you. So insurance companies that offer supplement plans here in California must offer supplement plans to those who are under 65. However, they do not have to offer plans to those who have end-stage renal disease or ESRD. Otherwise, the rates will be higher, but they are regulated so that they aren't excessively higher than the rates for those who would be getting Medicare at age 65. If you are pre-65 and you're on one of the really expensive supplement plans, or you're on original Medicare only, or you're on an Advantage plan, once you reach 65, that opens up a new enrollment period where you are able to get on the regular supplement plans that everybody else that's 65 and older experience at the same rates that they experience. California, you're just so massive when it comes to population, geography, all of the above, which is why it's been really hard to find a quiet place to record this video. But I hope this was helpful. Again, we have help for you. If you live in California and you want help with Medicare at no cost, please reach out. Email is in the description of this video. We're going to go explore California a little bit more, wrap it up here at Universal, have a good time with the family, and I will see you in the next state.